You need me to scoot in?
No, you're okay. So what brought you all into My Life Chiropractic?
I have a cervical spine injury, and I had surgery in '09, and I live with constant pain, and so I needed some relief. I needed something different.
What was your surgery?
It was in '09 where I had 5 levels of my cervical spine fused.
Oh, so they did surgery.
Yes.
Did they put screws in?
Yes.
Oh, wow.
And 2 years later, I had a car accident. I got hit head on, so right when I was getting better, I regressed. So I'm having to start all over.
And were you seeing doctors before that? Before the car accident?
Yes.
And what did they tell you about after the surgery?
Well, I went through physical therapy, and it just had to start all over again.
After that car accident?
Yes.
Okay. And what brought you into My Life Chiropractic?
My wife, what happened was y'all had a seminar at her school in Isleta.
Oh, okay.
And she went and attended that, and then she called me up. She was all excited and saying that she went with Dr. Leyva, and then the lady who does the massages, and she was very impressed, and she wanted to participate. She thought it could help me because my neck is always in great pain.
Right.
And so she set us both up an appointment, and we came in and met with Dr. Leyva. He did a whole bunch of different tests and exams and stuff like that, and he was very thorough in what he was doing. So I was very impressed, and we just stuck with him.
And had you seen any other doctors prior to coming here for?
As a matter of fact, I have arthritis in my throat and my neck, and it was really causing me a lot of pain, and I was taking medications, and as a matter of fact, I don't even take any medications for pain anymore.
Oh, really?
Yeah.
That's good.
Yeah, it's good.
So how has your all's experience been this far?
It's been great.
Yeah.
I've been working towards he has us doing exercises at home and using the dinner roll, and that has really helped my lower back because I've always had problems with my lower back, but it does help a lot. It's been about a month and a half,
No, well, a month and a half, about 2 months and a half, yeah. 2 months.
So I've seen a change already.
She's a very skeptical person, and she doesn't just take anything at face value. She needs to know much information. She digs in deep, and she's very impressed. And then what she's been in her range of motion, and I've noticed it, has increased rapidly. I mean, immensely. That she can look to the sides where she couldn't before.
Oh, wow.
So
oh, that's awesome.
He has techniques that he's using to help. These muscles in the front here are very tight, and they shouldn't be.
Right.
And it's making my muscles in the back here very loose. So he's helping me to loosen these so that my head's held up properly.
Right. And after the surgery, how much mobility did the doctors tell you that you were going to have after surgery? I had pretty good mobility. I did have pretty good mobility. The only difference is that over time, that was as good as it was going to get. And over time, I would not necessarily get better. So basically, the doctor just told you it's just going to be a kind of waiting game to see what happens? No, just they did their surgery, I did physical therapy, and then it ended. That was it. Oh, I see. And then I had the car accident, so I regressed again. Okay. And if anybody was in a similar situation that either one of you were in, what would you tell them about this place? I like that this is a corrective form of treatment. I like that we have a goal. We're looking at the x-rays that show where you are and what should be normal. And Dr. Leyva says that he'll be evaluating us down the road to see if we've had any improvements. So that's down the road after so many months that we'll compare it. Okay, awesome. What do you all feel has impacted you all the most since you all started treatment?
Amount of pain for me personally. It's been amount of pain that it's decreased in my overall my back and everything. As a matter of fact, so
because you said you're not taking your pain meds anymore, right?
So very limited.
Since you started treatment here, that's
pretty much gone out the window. Yes.
And I saw you were on crutches. What?
Yeah, I broke my foot. So I came into this already with a broken foot.
Oh, okay.
So,
yeah. All right. So I mean, other than that, you guys feeling pretty good?
Yeah.
Yeah.
Good, yeah.
A little more active?
Yeah.
Yeah. Okay, that's good. Well, those are all the questions I have. Like I said, very simple.